Medicaid non-citizen funding ends October 1. Providers act now. Welcome to Expert Billing Talk. Today, we are breaking down the critical CMS directive that cuts off federal Medicaid funding for specific non-citizen populations in just a few months. Because honestly, federal funding is abruptly vanishing for a massive chunk of patients.
Yeah, it really is.
And it threatens to turn predictable reimbursement streams into an uncompensated care crisis overnight if practices fail to prepare. I mean, picture this. It's October 2nd. A patient walks in, hands you an active Medicaid card, you treat them, and, well, a week later you realize you're never getting paid. Not a single dime.
Right. Well, that is the exact nightmare scenario heading toward practices.
Yeah.
The federal government is just, suddenly stopping its financial match for full Medicaid and CHIP coverage for certain groups.
And this starts October 1st, 2026?
Exactly. Under Section 7-109 of the Working Families Tax Cut legislation, that's Public Law 11921, the federal matching funds end for refugees, asylees, parolees, and trafficking victims.
Wow. So that is a huge segment of people. Does everyone in those communities lose it?
No, not everyone. Only specific groups like lawful permanent residents, Cuban or Haitian entrants, and COFA migrants retain the federal match.
Oh, okay. That's a relief for those specific groups, I guess.
Yeah, and, CHIPRA, 214 options for children and pregnant women remain completely intact, too. But for everyone else in those affected categories, that federal money just vanishes.
Okay, so to put this in perspective for everyone, this is kind of like a sudden software subscription cancellation. You assume everything is fine, your auto pay is set up, and then boom, access denied without warning.
Yeah, exactly like that.
But wait, won't states just step in and fund the coverage themselves to prevent a healthcare collapse?
You would think so, but here is the punchy truth. Most states will simply choose to drop the coverage rather than foot the bill with state-only dollars. That means the patient sitting in your waiting room might still hold a Medicaid card, but your clinic will be the one eating the total cost of their care.
Seriously, that is absolutely terrifying for a clinic's bottom line. But, I mean, these patients aren't going to stop getting sick. They will still show up at the front desk needing help. So what is the survival strategy here?
Well, because these patients will absolutely still seek care, the financial survival of providers hinges on emergency Medicaid.
Okay, emergency Medicaid. Why is that the lifeline?
Because it's the one area that actually retains its federal matching funds. But I have to warn you, emergency Medicaid demands rigorous clinical documentation, proving the necessity of treatment.
Right, and I'm guessing that comes with its own strict set of rules.
Oh, absolutely. It falls under Section 1903 of the Social Security Act. It is not just checking a box. Your clinical notes have to prove life, limb, or severe bodily function is at immediate risk.
So relying on old eligibility checks is just a recipe for disaster. What should a practice's action plan look like right now? Like, what are the required actions?
Well, first, providers must audit their patient populations immediately. You have to identify who falls into these specific non-citizen categories.
Got it. Step 1, audit. What next?
Then you have to implement real-time eligibility verifications to catch mid-month lapses.
Oh, right, because they could be insured on the 1st and totally uninsured by their follow-up on the 14th.
Exactly. And finally, practices need to build ironclad emergency documentation templates to prevent denials.
Yeah, capturing that level of granular detail without slowing down patient care is a massive operational hurdle, which is exactly why human medical billing helps U.S. practices fix billing problems, improve collections, and take control of their revenue.
Right. It's so important to have that backing.
You can head over to humanmedicalbilling.com to sign up for the free weekly Xpert Billing newsletter. Plus, they promote a 100% free, no-strings practice analysis, and there is absolutely no commitment required.
Getting ahead of these regulatory shifts with solid back office support really is crucial. Yeah. But, before we wrap up, I want to leave you with a final thought. As safety net hospitals and rural providers absorb the brunt of this uninsured surge, how will your local healthcare ecosystem adapt to the impending spike in charity care?
Thanks for listening to Expert Billing Talk. See you next time.